Anjay Azlan here.
Yeah. Hi, how are you?
Heading to Caring Pharmacy, right?
Yep, that's right.
Okay. Wow, balik from hospital, straight to pharmacy ah. Why ah? Here got no medicine ah.
I'm just here to see the doctor actually to get my prescription. It's more convenient for me to get my medicine from Caring.
Hey, but why more convenient? You have to go to 2 places, right? If it's me, I think I forgot to take my medicine already.
Oh, I use my health record in the Caring app. Everything is at my fingertips.
Wow, got such a one ah. What does it do? Can you share with me more?
Oh, it's quite easy actually. Now, let me explain. My health record is an electronic record system that helps me record all my medical data, including the medication I'm taking. It helps me better manage my health because it allows the pharmacist to consistently review my medication. The doctor can also better understand my condition by looking at my health record. For example, they can check my blood pressure and blood glucose readings. So convenient, right? Saves the doctor time on looking for files too. Also, my health record helps to streamline my medical care between all parties. Don't worry, it is very safe and secure to keep all our medical data private and confidential. So many features, right? Hey, stop. We're here already.
Oh, let me find parking. I'll join you inside.
Okay. Sure. Manage your health better with My Health Record. Like me. Sign up at your nearest Caring today.
Anjay Amma here.
Yeah, hi.
Wow, so many medicine ah.
Yeah, need to stock up.
Huh? Then you should know about carrying My Health Record app. Come, I tell you.
Hi, good afternoon, everyone. Thank you so much for tuning in to our Facebook live stream with Virus today. I'm Bernard, a caring pharmacist, and I am so honored to be your host again for today's session. So today's topic is a trending topic for now, okay? But it's not about COVID, but somehow it's very closely related to it, which is low back pain, especially during this pandemic, where everyone is working from home, having online classes at home, after sitting for long hours, including me. I believe that a lot of us will have our lower back pain very much be affected. So that is why for today's topics live stream, we'll be focusing mainly on lower back pain, the causes, symptoms, and how we can manage or even treat it. So if you thought of anyone which may be benefiting from today's topic, please stop what you are doing now, share this live stream to them, and let us learn more together about it. So today we have someone very special to be our honored guest to talk about this topic. He is a person who is very experienced in this field with us today. He's an orthopedic surgeon, a traumatologist, and also a sporting injury specialist in Columbia Asia Hospital Bukit Rimau, Shah Alam. He specializes in orthopedics and has over 20 years of experience in his field of expertise. So if you have any burning questions or concerns about today's topic, let us know in the comment box below. and we will get them answered by our expert. So without any further delay, let us welcome our honored guest for today, Dr. Harjeet Singh. Hi, Dr.
Hi
Harjeet.
everyone.
Welcome.
Hi.
How are you feeling today?
I am feeling
Yeah,
great. I am raring to go. I am very thankful to be here with all of y'all. Thank you to Caring Pharmacy, Whitetrace, and Columbia Asia for giving me the honor of being with all of you.
yes, okay. Dr. Harjeet, I think recently we have seen the cases of COVID has been reducing. So does it actually increases your patient which come here for orthopedic related problem recently?
Well, thankfully, yes. There was a time where everybody was trying to keep away from the hospital. The pandemic is something that we never expected to see in our lifetime.
Yes, correct.
And,
Yeah.
but the pandemic has brought its own non-COVID problems. We have started
Yes.
working from home, and this has brought about certain ergonomic issues, including neck, back pains, wrist
Ah,
pain, and those kind of overuse problems. And for surgeons, sports surgeons like me, there has
mm,
been a dip in sporting injuries,
I
and
see.
this has been balanced by the other problems created by the COVID.
Yeah. Speaking of that, I started to feel that my neck is quite numb when you mentioned about this. Okay, so Dr. Hajit, just right before you entered, okay, I told audience that especially now, most of us still are working from home, and a lot of us are actually sitting the whole day attending to the PC right in front of us. Okay, I think lower back pain is something more relevant to us and is actually much more prevalent than what we think. Okay, so doctor, okay, since you are here, can you explain on how prevalent lower back pain is?
Well, if you look at things, if you look at the burden of this problem, even before the pandemic, up to 10% of adults do suffer from lower back pain at any point of time. So, in a room of 10 friends, one of them would have lower back pain. And this is not only a problem unique to Malaysia, all across Asia, even in China, Philippines, Thailand, the literature shows that up to 30 to 60% of the population do have back pain at any one point of time. Now, the problem with lower back pain is it causes disability, and this disability causes highest cost for workers' compensation in industrialized countries and also our developing nations. The thing being that if you have lower back pain and you're away from work, you aren't able to contribute significantly to your job and progress. Additionally, if you have chronic lower back pain troubling you for periods of time, you will develop sleep difficulties. And as the problem manifests more and more, it can develop to anxiety and further on to depression if not identified and treated appropriately.
I see, doctor. To be honest, I was surprised with the figures, and I didn't expect that it is something so serious in our community and also in other countries as well. So since now we know how widespread and serious about this problem, I believe that our viewers will definitely are more willing to know what low back pain is. Okay, so could you explain it to us, doctor, to let us have a better understanding on this issue?
Yeah, I think that's a fantastic way to start, Bernard.
Mm,
So, low back pain can range from intensity from a dull, constant ache to a sudden, sharp, or shooting pain. It can result from an accident, but it can also develop insidiously. That means over a period of time, some amount of pain can develop and become worse. Sometimes, if we are sedentary, followed by a period of increased activity, strenuous workout, or exercise, we can develop back pain. So, simply said, back pain itself can be developed into two types. The first one is acute back pain. I call this, in all probability, the simple back pain. 95% of low back pain is acute. It is short term, it lasts a few days, and in all probability, gets better and goes away with rest. unfortunately, some people do develop chronic back pain. They have periods of lower back pain interspersed with periods of being well, and there is a fear of increased activity causing a recurrence of pain. This is pain that usually has persisted for 12 weeks or longer. But regardless of what we do, it is always important that we are not treating the spines. We are actually treating the patient as a whole. The concepts have been actually explained by Waddell way back in 2004. Okay, just to take us very briefly through the lower back. Now, we have the vertebrae, which are actually our spine bones. They are all stacked up from top to bottom. There are 5 lumbar vertebrae. In between the vertebrae is the intervertebral disc, or the shock absorber, as I try to explain it as.
Yes, yeah,
And
like our brake pad.
yeah, the brake pad. Now, every time anyone has a back pain, we will jump and tell them that, hey, maybe you have a slip disc. You know, the neighbor will tell you, the uncle will
Yes,
tell
yes,
you.
yes.
Now, if we look at the structures, there are so many other things happening. Between the spine bones, you have small joints that allow some amount of movement, and that's called the facet joint. The nerves which supply the body parts of the lower limb, they come out between 2 vertebrae or 2 bones, and there are ligaments holding the whole structure together. So when you look at back pain caused by problems at the spine, there are so many parts that can go wrong.
Yes, correct.
Although thankfully, 95% of the time, it's something easily treatable. Now, when you look at pain, there are 2 kinds of pain. These are big words. One is neuropathic pain. Neuropathic pain, simply explained, is nerve-related pain. So this is pain that is usually difficult for patients to describe. It is described as, I have a burning kind of pain, I have tingling, I have this funny feeling. Some patients come and tell me straight, point blank, MAPI. They use a Chinese word. It's so common that even surgeons like me have picked up that description.
Yes. Mapei or Kantong, I think these are the common description that they will make when it comes to the neuropathic pain. Yeah.
Yeah, because it is very, very difficult to describe. Now, the other pain that we have is actually nociceptive pain. Nociceptive pain is the pain that we are very familiar with. If I punch you on the arm, Bernard, the kind of pain that you have is probably going to be a nociceptive pain.
Yeah, this is the ouch type of pain. Yeah.
Yeah, this is the pukul orang kind of pain. Now, this is pain due to inflammation, the pain that we have when we have a fracture, or even when we have an appendix or a tummy cramp. This is all nociceptive pain. It's easy to describe. We actually say that we have an aching, we have sharp pain, there's a throbbing. And the worst part about this is, if we look at back pain is often a mixed pain, which means that there is a nerve-related pain and there is also an inflammatory-related pain, and they combine together to cause back pain. Almost 50% of pain in low back pain is actually mixed pain.
So it comes like a package.
Yeah, it comes in a package in 50% of people. So if we are not mindful of that and we only treat one facet of this pain, only 50% of people will actually do well, or you get 50% recovery.
I see.
Let's look at neuropathic pain. If you tell me how it feels like, some will tell me that there's a tingling, some say there's pins and needles, some say there's burning, some say there is an electric shock like. So when patients come to me and they use these kind of vague descriptors, I know that in all probability there is a nerve-related element to this lower back pain.
Yeah. Okay. So since we have all these symptoms, okay, so is there any specific cause for this low back pain, or anything that we can trace back what leads to this all this type of pain?
Yeah, I like the way you put it, and this is how I normally try to simplify and explain it. I've just explained that we've got the spine bone, which is the vertebra, and the pain, when it's due to problems at the spine itself can be from the disc. And when the disc irritates the nerve, you not only have back pain, you have pain which is running down the leg. And a lot of us say that I've got this sciatica kind of pain, and that's because of nerve irritation. So the pain from the disc may be nociceptive, that's inflammation, but the irritation of the nerve causes the neuropathic pain. Now, when we look at bone does not have any pain fibers, but the coverings around the bone are richly supplied by the nerves. So any fracture, infection, or wear and tear can cause some amount of pain. Now, last but not least, the most commonly seen pain is often from a muscle. If you have a muscle strain or you injure your ligaments around the spine, they can also cause pain. Now, what I want to point out here today is that if you look at back pain is merely a symptom. It's a symptom of pain around a part which is your lower back. However, the nerve supply for certain parts, they crisscross, and therefore gynecological causes, any problems with the blood vessels in the abdomen, any problems in the kidney and your ureter, such as ureteric stones, or your gastrointestinal tract. For example, stomach ulcers can come to the hospital as lower back pain. And most of the time, they see an orthopedist like me, but when we try to elicit the symptomatology, the story, so to speak, from the patient, we realize that this is not an orthopedic problem, and we move them on. So causes of back pain can be from the spine itself or non-vertebral causes, which can be very, very different and myriad.
Yes. Okay. So, like what you mentioned, they might involve multidisciplinary to treat this specific
Yes.
issue. Okay. So I think what you have mentioned just now, we have one audience viewer that come across this question. By Lo Seim, this our viewer is asking, can lower back pain caused by muscle? So I think you have answered about this. I think definitely it can cause by muscle, right?
Yeah, so Lo, the best part is most of the back pains that we get with everyday activity, whether it's exercise, poor posture, invariably is related to the muscle, 95%. And this is the one you probably rest it out a bit, take some simple medication, and it goes away. And I call it safe back pain. So yes, most of it is from the muscle.
Yeah. Okay, so doctor, I also remember that in your previous slide, you mentioned that there are two types of low back pain, which is acute and chronic. So is there any way that we can determine a person's low back pain, whether is it acute or very serious, okay, or any signs that highlighting us that the person has this acute or chronic low back pain? So right before you answer us, okay, I think just want to tell our viewers, the lucky viewers who are online now, please don't forget to answer the questions pinned at the comment box below, and you may be the lucky one to stand a chance to win a basic wellness profile screening test at Columbia Asia Hospital, Bukit Rimau, Shah Alam, which is worth 150 ringgit. Okay, so maybe I 2-liter exercise followed by a strenuous workout cause back pain. I believe that the answer was already highlighted by Doctor just now. And don't forget to hashtag Caring Pharmacy and hashtag Vitrace along with your answer. We will then randomly select and message the winners with the most accurate answers after this session. You can also like, share, and tag 3 of your friends to increase your chance of winning. So, Doctor, come back to you to answer the questions that I've asked just now.
Okay, so all the best. I hope you guys win. Okay,
Yep.
but let's look at lower back pain. Now, the thing about the general principle of treating lower back pain, first and foremost, is giving the best possible relief to the pain. I think this is clear. Someone comes with you with a problem, the principle of care is, okay, let's kill off the pain. And we also understand that in certain situations, total relief of pain may be not essential for reduction of disability. What I mean is that as long as I can control the pain to a certain extent, I can initiate the patient or person back to some amount of activity to maintain muscle function, and that also helps him. And as the pain comes down, they become less anxious. We are able to educate them and they get better. Now, so if we look at acute back pain, Bernard, you did point out that the worry is whether we are missing something dangerous.
Yes,
So
correct.
the first thing that we do is often rule out red flags. These are actually potentially dangerous symptoms that indicate that this pain is something more than just that 95% simple back pain. And
Okay.
as we move down, once we have ruled that out, we reassure. You see, you are now dealing with someone who has a lot of pain and is very worried and has no idea why this suddenly happened to them. And I think explaining the problem and line of care after you control the acute pain is important. How do we control the pain? We give them symptomatic pain relief with paracetamol, non-steroidal anti-inflammatory medication based on our pain score and the way we assess them. The idea is, as we control this acute back pain, is to get them up and about, continuing some amount of activity. The reason being, prior to this, some time ago, anytime you have back pain, we will say, okay, you rest it out, you rest it out. And we found that if you have someone who rested for longer periods of time, beyond 48 hours in bed, their recovery was often slowed down because even the muscles started functioning poorly and losing their memory to function. And when we have acute back pain, after we have ruled out the red flags, as I pointed out initially, we avoid unnecessary over investigation. And the goal of all this is to return back to function and work as soon as possible.
I see. Okay, so doctor, so
Yeah.
in to make it simple, the how to say the things that you highlight is we are trying to let them treat and also to let them to go back and adapt to their current lifestyle as fast as possible. Is it something like this?
Yes, because the way I look at it is that when you have a problem, we fix the problem so that you can get back to whatever you were doing before.
Yes.
Okay, that's the simple way of looking at it. But
Yeah.
once you are able to control the problem, the faith of the patient is also increased. They believe in what you're doing is the best for them. And I always feel that when you're treating a problem, you're also treating a person's mind.
Yes, correct.
So, when I have pain, I'll be thinking, oh my God, am I going to be bedridden? What's going to happen to me? How long is this going to take me away from my favorite game? How long is it going to take me away from taking my children to the park? So, there are a lot of things that we treat. We are treating people. We are not treating machines, you see.
Yeah.
Okay. Now, unfortunately, despite of all that we do, some patients go into chronic lower back pain. Now, there is a very small subset that move on from acute pain going on to chronic pain. A larger subset of patients actually have a lower level of pain which lingers on, and they develop chronic low back pain. Once you have chronic low back pain, your treatment is multimodal. That means there are many, many small ways and different ways that we try to help this pain. We try to help people to be functional, and for each person, it is individualized. That means what works for me may not work for you, Bernard, and vice
Yeah.
versa.
Okay. So I
Now,
think when mentioning this, there's one question from our viewer, Michelle Sandu, comes in at a perfect time. Okay.
okay.
She's asking, is there any way to cure chronic back pain?
Yeah, Michelle, actually, your question is like the holy grail for all of us orthopedic surgeons. A lot of times we aren't able to completely cure chronic low back pain unless there is something that we can anatomically fix and then we rehab the patient appropriately. Actually, your question came just before I actually was about to put up slides that tells us how we manage chronic low back pain and
Mm.
how we actually get people better. So I think I will just move
Yep.
and answer your question
Yes. Okay.
now.
So yeah. Okay. So
Okay.
yeah. Please continue. So I
Okay.
think when they are like people with lower back pain, so when should they consult a doctor? Okay. So or if let's say what are the symptoms that actually require urgent care for this lower back pain?
Okay. Now, when we treat patients, we also assess the personality of the patient.
Okay.
We understand that some of them are prone to go into the tendency to develop chronic low back symptoms following an acute episode. These are patients that believe that back pain is harmful and disabling. So, if we educate them that it is not so, they can be managed better. Patients who fear and reduce their activity, fearing that they will develop pain. If you have patients whose tendency is to have a drop in mood, their expectation is towards passive treatments. That means they normally are reluctant to do active exercises to get the muscles stronger.
Okay.
When you have a bit of poor job satisfaction, stressful issues, heavy work, and when you have overprotective family members or total
Yes.
lack of support, these are what we call the yellow flags. So these are
Mm.
patients that I spend more time with
Mm.
because I want to be the person that gets them better, and we actually look at all the social issues. All of us know that sometimes if we are stressed at work or work is piling up, we tend to develop a lot of aches and pains, and these are also something that mimics yellow flags. Now,
Okay.
if we look at when doctors should be consulted and what are the symptoms that requires urgent care, the pandemic has taught us that not everything needs an immediate visit to the doctor. We now understand that there are certain scenarios. Now, I've mentioned that 95% of back pain is simple back pain requiring only rest.
Mm.
95% of lower back pain and is almost always from the muscle or a strain, and we can treat them on our own. But what's important, if you have lower back pain that doesn't get better over the first 24 hours of rest, or you have what we call the red flags, and
Mm.
these are symptoms that require urgent care. Now, the lower back pain red flags indicate that the pathology causing your pain can be serious and they require immediate investigation or probably specialist referral. So I divide them into three broad groups. The first one, a possible fracture. Now, if
Mm.
you are involved in major trauma, okay, I'll give you two scenarios of major trauma. If you are involved in a motor vehicular accident, you are a passenger in a car where the driver passes on the spot, you step out seemingly okay and you have lower back pain,
Uh,
you are a red flag. You require proper assessment, not just taking simple pain relief because you think things are minor, because you have been involved in major trauma.
okay.
Any pedestrian, okay, which has been knocked by a vehicle beyond the speed of 40 kilometers an hour is considered major trauma.
Okay.
Yeah,
So
so
this is how you all classify whether how severe it is or any possible major risk for this group of patient.
yes, so we
Mm.
always have these assessment algorithms. Now, the good part and what we need to remember is
Mm.
in the elderly patient where the bone is osteoporotic, which means it's softer and than that of a adult, any minor trauma such as falling from a chair and they already complain of lower back pain, we have to look at it that they might have a possible fracture. Because if I fall from the chair, I better not break anything because I
I see.
still have good bone density. But the elderly, that's one whole group. Now,
Yeah.
the second group that we have to look at is any possible tumor or infection. We know that back pain is supposed to be less common in the young. And
Yes.
so if you have someone below the age of 20 complaining of severe lower back pain, particularly if this pain is very bad while they are resting and also increasing at night. So this is one of the red flags that it might be due to an infection in the area.
I see.
Okay. Now, if you had someone who has never had back pain and comes in with lower back pain and he or she is beyond the age of 50 years, particularly if they have a history of malignancy of another body part, they have had some immunosuppressive or intravenous drug use for any other reason, they come with any constitutional symptoms such as fever, chills, weight loss. This is the second scenario where we have to consider infection or a tumor. Now,
I
so this
see.
is the second red flag.
Yeah.
Okay. Now, the third one, if you have lower back pain where it is associated with weakness of your leg, you can't really walk, not because of the pain, but it's weak. You can't control your bladder or bowel, which means that your pee and poo, you can't really get it right.
I see.
And this is worsening. This is the third red flag. So these three groups are when that you can't self-treat, don't sit on it, go get it looked at by a doctor because you possibly will need specialist referral.
Yeah. Okay. So, doctor, since you are mentioning about this, okay, we have one question from our viewer, Miss Vivian Tay. Okay, she was asking, I think it's quite a specific question on this. So, she's highlighted, will vertebral compression fracture cause weakness in leg? I think this is what you just mentioned previously.
Yeah. So if we look at this, a compression fracture of a vertebra in a young patient is most likely due to a major trauma, Vivian, and a major trauma can always cause a neurological deficit. So to answer your question, yes, it's possible. Be mindful that even a minor trauma in an elderly patient can cause an osteoporotic fracture.
Yeah. So I think due to multiple factors, like including age and also certain medical conditions, so different symptoms or different scenario may lead to a totally different outcome. So I think after sharing so many things, I think I believe that our viewers seems to be scared off a bit. Okay, so now we want to move on to treatments. Okay, tell that everything is still under control. So are there any specific treatment options, or like what they always ask, what are the medication or best medication for low back pain, or is there any such thing as best medication for where one pill fix them all when it comes to low back pain treatment?
Well, us doctors, as we get slightly older, as you can see from my graying beard, okay, we understand that low back pain presents differently in different people. The severity is different in different people. And even the causes are a whole range, like I've mentioned before.
Yes.
And similarly, the treatment option is individualized. But if you look at it broadly, the main thing that we as people suffering from lower back pain can do is we can modify our activity to optimize both in prevention and treatment of lower back pain. The second thing is there are medications that we can take. Physiotherapy helps, occupational therapy. If we are educated and we know the do's and don'ts, we can manage our pain better. I think very important after you have had lower back pain is a prevention program. We have to understand that the battle is in the body as much as it is in the mind. So psychological approaches are important, and there are a lot of assistive devices that we can use to get us comfortable. So this has brought out that in approach of treatment of pain and lower back pain, the biopsychosocial approach, while we put medication as pharmacotherapy right in the center, we know that sleep hygiene, which includes getting adequate sleep, sleeping appropriate times, not fiddling with the phone in bed, using our sleep time as our rest time allows us to manage pain better. Lifestyle management, stress management at work and play at home, everywhere. A modern lifestyle is stressful. This needs to be managed. Physical and occupational therapy. There are interventional pain management, that there are certain methods that we can use by injectables or radio frequency to reduce pain. But I feel that complementary therapies such as acute soft tissue massages, acupuncture have been said to help the treatment of back pain. But all this requires appropriate education
Yes,
and
correct.
feedback from the patient. I think education is king, even
Yeah.
now. I mean,
Mm.
I don't know, after money, education is king or education is more important than money, but
Yeah.
that's the way it is. Now, look at activity modification. Now,
Okay, Doctor, before you
yeah,
move to activity modification, I think there's one question just come
great.
at the right time, okay, from Junior. This viewer is asking, is yoga a good treatment, right? Because I
Oh,
think a lot of people, they'll correlate yoga, whether is it a treatment option when it comes to pain, low back pain improvement therapy, or you have to go through a proper education and proper evaluation on the condition first before we can move on to this yoga.
okay. Let's look at it this way, Yaji. I
Mm,
think your specific question about
mm,
yoga is definitely great in preventing lower back
mm,
pain. And after you have had lower back pain and appropriately treated, it is important to prevent a recurrence.
I
See,
see.
the thing about yoga, it maintains flexibility, it maintains muscle function, it maintains our balance, and it also works on our mind. So these are the four facets very, very important in treating pain. So I think yoga helps. As a matter of fact, I do encourage my patients to always get more active, sporty. I involve them in yoga or
Mm,
Pilates, and this actually helps them on the long run.
yeah.
I
So I
think, yes,
think,
yoga is
yeah.
good.
When you mentioned about Pilates, I think this also answer the question by Miss Oni Yi. Okay, she also asking about can Pilates help to improve low back pain? So I think from your answer, it is yes. Okay, yeah.
Yes.
After you can continue with your
Okay.
explanation. Thank you.
So now, the way we sit and stand is important. And if we are sitting in a flat chair, putting a small pillow at the small of the back helps supports your lower back. When we get up from a chair, we use what we call the hip hinge. That means we actually stand up, hinging movement at our pelvis and hip. Now, now the pandemic has made us work from our dining tables, from our sofas, from everywhere except an office table and chair. So if we have to have our work surfaces at appropriate height, we are now moving things around the house. So when you're lifting things, please think before you lift, be mindful of the way you lift and the the weight that you're lifting. Even your sleep position, the sporting activities that you do, and even sex, there are modifications that we can do to get comfortable. So
Yeah.
let's look at sleeping. Now, look at it. Humans are so individualized and different. Some of us sleep on the back. Now, if you
Mm,
sleep on the back, putting a small pillow at the knee to keep the knee slightly flexed reduces pressure on the lower back. And the kind of pillow that we use should keep our neck straight and not flexed or hyperextended, as in here. If you sleep on your tummy, it is always good to put a small flat support at your belly just above the pelvis to reduce pressure on your lower back. And I tend to sleep on my side, so I am mindful, even though I don't have
mm,
significant low back pain, to bend my knees to allow the spine to straighten out. So that
I,
is sleeping. Very easy to do, not rocket science.
yeah.
And you can even Google these sleeping positions. You don't need to see people like me.
Yeah. For the third position, I remember like for pregnant ladies, they also recommend to use such a bolster or pillow when they are sleeping sideways to prevent the back pain as well. So yeah, okay. Coming back to this question, when we come to this lifestyle modification, there are suddenly so many questions coming in because I believe that a lot of people they want to know more about this. So G Junior have another questions coming back again. So is asking if I have lower back pain, can I still do the weightlifting? I believe that this has been explained in your previous slide, right?
Actually, okay, look at it. If you lift weights, I think it's a good way of being active. Okay, but you have to do it appropriately. The first thing is you have to understand your base of fitness and the weight that you need to start on. And then we need to not get excited and increase the weights too fast. The current recommendation is increasing it by 10% every week to 10 days. It's not like today I lift 5, tomorrow it's 10, and the next week is 15. It doesn't work.
Yeah.
Now, the second thing is the way your posture that you actually do to lift your weights, very, very important. Some of them, as they lift higher weights, they actually use supports to support the lower back. So, to tell you, the mere fact that you have low back pain after lifting tells me that there are a few things that have gone wrong, need to be corrected, need to be treated. And once you are all right, being mindful to not repeat the problems that caused your pain in the first instance, you can continue lifting weights. I think
Yeah,
it's
thank
fine.
you. Yeah, thank you so much, doctor. So, and then when it comes to sleeping, I think we have been spending 1/3 of our lifetime on sleeping. There are a lot of questions about this sleeping, and a few of them are asking, actually, is there any type of mattress or bed that you recommend for people with back pain?
Okay. All right. So, firstly, I've been told that I'm not supposed to advertise anything on Facebook. Okay, but this is the way I look at it.
Yeah.
Not necessarily the most expensive mattress is the best mattress. Okay. We know for a fact that we have certain postural positions which are favorable when we lie down, which means that a mattress that is too soft will not allow us to keep posture. Something that is too hard, so the mattress should be firm. Okay, it should not wear off very, very fast. There are orthopedic specific mattresses, but when I look at them deeply, although the research has been done, it is not necessarily that you need to buy the most expensive mattress. Ultimately, it has to give you support. It has to be firm. It has to not to be saggy that it just curves you without being mindful about your lower back. That's
Okay.
one.
Yeah. Okay. Thanks, doctor. Yeah. Okay. Go back to the slide. Yeah.
Okay,
Thank
there
you
are
so
many
much.
questions, Bernard.
Yeah.
Okay, no, let's look at a simple thing, sitting. Now, from the base of the head, if you draw a straight line, it should cut you right at your tailbone. So when you sit up straight instead of slouching, okay, you tend to have less lower back pain. If your chair is very rigid and straight, putting a small pillow at the curve of the back helps support the spine. Now, if we look at a desk, a work desk, look at this chair. It has a nice lumbar curve. Okay, when he bends his forearm, there is a 90-degree bend to the elbow. The wrist is not overtly extended. The eye is at the level of the middle of the monitor. He is comfortable. There is a neutral position at the ankle. So this is office ergonomics. It prevents both neck and lower back pain. So I've gone through sleeping. Now this is sitting. The next one is look at good posture. From the base of the head right up, it cuts right up to the ball of the foot. Now, this compared to if you have a slouch with a rounded shoulder and back, your tummy is pointing out because of weak abdominal muscles, your back is swayed, or you have a flat back and you are crouching forward, this is because your core muscles are not strong enough. So ultimately, the thing that holds us up is our muscles. And posture, good posture is a function of good muscle balance and functioning. So that's
Yeah.
important.
Yeah, doctor, I have one question from myself. Okay, so I think you
Okay,
mentioned about the chairs. Okay, I believe that in market there are a lot of like what they so called the gaming chair. Okay, so for those professional gamers, and a lot of them when in their marketing strategy they have been telling these type of chairs are specialized for ergonomic and also for back lumbar support. So from your expertise, does it actually really works for this?
No, but the gaming chair, okay, I actually was fortunate enough not to buy a gaming chair, but actually have I was fortunate enough to use a friend's one. Okay, now a good gaming chair is very ergonomic.
I
So
see.
ultimately, it is designed to keep you there playing the game for the longest period of time. Okay. And the thing about it, the most of them, they allow a lot of customization on the movement up and down, the tilt, the height of the handrest. So they tend to be very ergonomic.
I see.
Of course,
Okay.
they also tend to be very expensive, Bernard.
Yes, correct. Yeah.
Yeah.
Okay. Thank you. Thank you so much for this. Yeah. Okay.
Okay, now, how do we lift? Now, forget about how we lift. I think if we're going to carry something, be mindful whether we can get someone to help us while we carry it if it's too heavy, or we can just probably put it on a trolley and drag it along. Even the kind of handbags and luggage bags that we use, a lot of us now, including me, I actually use a trolley kind of bag just to
Yeah.
carry heavy things around. But if you're going to have to carry something, make sure that you actually use your hip hinge. You go down right to the bottom, and when you get up keeping your lower back straight instead of hunching this way. This is a recipe for disaster.
Yeah.
So if you look at this, you lift it up, you go up straight, and then you bring the thing that you're carrying close to your body, Bernard. You keep it
I
close,
see.
so it's close to your center of gravity, and then you move on and you place it down the same way that you lifted it.
So it reduces the pressure towards your lower back.
Oh, yes,
Lower back. Yeah.
it
Okay.
definitely does. And, don't be in a rush to lift and go. You do it very controlled movements, deliberately, as if you want to protect your back, and it actually
Yes.
works. Now, pharmacotherapy, this simply means the medications that we use to reduce the pain. Now, once we know the element of nerve-related or inflammatory pain that we have, we manage the underlying problem, and this gives the best reduction in the pain. We have to individualize the treatment. We prescribe adequate dose, and we also do it for the appropriate duration of the pain. And like I mentioned before, we use multimodal therapy because there are many medications that we can use, from simple analgesics such as paracetamol, easily available over the counter, compound analgesics, including the non-steroidal anti-inflammatories, the opioids, muscle relaxants, anticonvulsants. So when I say multimodal, is you combine certain medications for good benefit while we reduce the chances of an adverse effect. Now, a lot of the questions, Bernard, has been asked about therapy, rehabilitation, yoga, and Pilates. And all these have a similar goal, and they are important to bring us back to where we were before we had pain. The goals to return to normal functional activity. That is always my goal in spotting injury and in any patient that sees me. I also advise them to prevent further injury. I get them back to optimal strength, endurance, and coordination. This is very important to prevent recurrent injury. Now, what are the phases? When you come in with a lot of pain, you are in acute phase. during the acute phase, the main concentration is in methods to reduce pain. So this may include passive methods such as heat, cold, electrotherapy, some amount of traction as you recover. And as the pain gets better, you move to recovery phase. Now, recovery phase, we move from passive techniques where therapy is done onto you while you lie down or sit down to active, where you have to do certain movements. That means you have to learn how to stretch, you are taught exercises to strengthen, and you move on to aerobic exercises to get you stronger, improve your balance and coordination. Now, yoga comes in during active type of therapy. So yoga, Pilates, going back to the gym, doing exercises on your own, home-based exercises are all active. And it is important to move the patient from passive to active so that they don't go into a chronic pain syndrome and they recover on. Now, the last but not least, the phase that we forget all the time is maintenance. Now, once we are okay, Bernard, you had your pain and you're fine now.
Yes.
If you go back to the same bad habits that caused your pain in the first place, you obviously are going to have pain again.
Yes, it's a bad rotation of the cycle, because I think most of the people, once they get better, then they will tend to forget about it, and then they'll go back to the normal. So I think, doctor, you mentioned a bit about this acupuncture. We have one audience, Miss Jessica Lee, asking about, is traditional Chinese medicine treatment like acupuncture help for lower back pain? In your expertise, do you have any of such experience where it works together with some sort of acupuncture and you see improvement for your patient?
Yeah. Okay. So, Bernard, the way I look at this, right, I feel that the modern physician cannot be totally disregarding all these traditional methods. A lot of them have a science behind them. The use of acupuncture for acute pain, it's very scientific. Okay.
Yes.
But I think what I need to point out is that while 95% of lower back pain is simple, safe lower back pain, there are 5% which are dangerous lower back pain, including those which have the red flags. So I think lower back pain is a common symptom. I think getting the diagnosis is important.
Correct.
So, 100 people going to treat their back pain, regardless of where they go, whether they go to the doctor, the therapist, the traditional healer, 95% of them will get it right, but 5% of them are going to be worse off. So I think getting the diagnosis is most important, but I'm not totally disregarding traditional methods.
Okay, thank you, doctor. Okay, so I think since we have still a bit more time, okay, so I think, do you have any real case stories of your patients with low back pain that you can share with our viewers that may inspire them also, or can provide some sort of warning so that they can relate their real life condition back to what you have experienced before?
Okay, I think that's a very good way to end this. Okay, I have two scenarios. Okay, one is a 55-year-old. Okay, once you're 55, you don't need to have a gray beard like that. A lot of them are walking on, and age is just a number. So this is a 55-year-old man who's a very good golfer, and he had lower back pain after a bout of golf. And initially it was right at the lower back, and then it got worsened and it moved down to the buttock. That means he had suggestive of some sciatica. When I examined him, he did not have any muscle spasm, which was minimal, but no nerve deficits. That means there was no weakness, there was no tingling, there was no numbness. So if we look at the whole protocol that I've explained for the past 20 minutes, this gentleman, who is a sports person, had a small level injury, but he's beyond the age of 50 years, which prompted me to still investigate him with an X-ray, which was normal. And I treated the muscle spasm appropriately, and he was back to golf after about a week and a half, although he wanted to go back early. So There was a medication that I prescribed. There was physiotherapy to reduce the muscle spasm. The actual reason was he had recently bought a new golf club, and his golf swing was changed by his golf pro, and I think the biomechanics were different and he got back pain. So I brought him back to where he was. So this was a simple one. Although if you're above 50 years old, it is better to get imaged. Now, the second one is something that I use to remind myself and the students that I teach. 60-year-old lady, she had a spine surgery some months prior. Okay, she was seen by the treating surgeon, who's a good friend of mine, and everything was all right. And after 3 days of seeing her surgeon, that means this is about 4 months since her initial surgery, she had pain. It was worsening, and she was complaining of night pain when she saw me. When I examined her, the wounds were okay, but there was a lot of tightness of the muscle. So I told her that, your surgeon just saw you a few days ago. I think things are fine. I gave her some medication to reduce pain, but there was something lingering at the back of my mind. So I told her, you take this medication. I see you after 2 days, and we see how you are. After 2 days, she was actually having significant pain. There was minimal reduction despite the medication. And mind you, this was good, high quality medication which I gave her. So I proceeded to do imaging studies, including an MRI, and we picked up an early infection, which I then sent back to my friend, the spine surgeon, and he was able to treat it with antibiotics for a period of time. So sometimes the literature tells us a lot of algorithms of how we need to tell, but as you gain experience and sometimes you have a funny suspicion, and I think this is very important, that when you treat your patients multiple times, you kind of get the character of the person. So this 60-year-old was never a complainer. She's not the ayo I got pain kind of person. So it's just that when she had pain, I was mindful and we picked up the problem. See, that these are the two examples that tell you lower back pain is something easy, but at times very, very challenging.
Yeah. Okay. So I think is a very relevant real case. Okay, then I believe that somehow some of our viewers may relate these real cases to someone near to them, which may experience this. So I think what the take-home message is, although we don't want to be over worried about certain condition, but we must aware that same situation or same symptoms may lead to 100 different diagnosis outcome. So I think always consult a doctor and get the proper diagnosis. Then it may only will bring us to the proper treatment. Okay. So before we move into the last Q&A session, okay. So once again, don't forget to answer the questions pinned at the comment box below, and you may be the one to stand a chance to win a basic wellness profile screening at Columbia Asia Hospital Bukit Rimau, Shah Alam, which worth RM 150. So the question is, will getting too little exercise followed by a strenuous workout cause back pain? Okay, so don't forget to hashtag Caring Pharmacy and hashtag Vitress along with your answer. We will then select and message the winners with the most accurate answer after this session. You can also like, share, and tag 3 of your friends to increase your chances of winning. So, Doctor, I think since we have a couple of minutes left, okay, we have another question from Miss Jessica Lee. I think this question is very relevant, and a lot of people may want to ask about this as well. So she is asking, is seeking regular treatment at chiropractor advisable? It is quite expensive though. Yeah.
Wow, Jessica, I was hoping nobody asks me that question. Okay. Even certain shows that I do, they always ask me about, is there a battle between the orthopedist and the chiropractor? No, not at all. Now, once you have to understand that low back pain requires multimodal strategies in effective care, and the chiropractor is one of the facet in this whole pyramid of care. And if you get a good chiropractor, you have obtained a diagnosis that this is not a dangerous lower back pain, then of course you can go and see a chiropractor for certain techniques that they use are seemingly effective.
I see. Okay. Yeah. So, okay, before we end our session today, okay, doctor, do you have any advice which you would think is the best takeaway for to benefit our audience and viewers who are watching our live stream right now?
Okay, Bernard, I think your takeaway has been the best one, but
Yeah.
I will try to add on one. Okay, low back pain requires multimodal strategies in effective care. That is clear, I think, from my presentation.
Yes, correct.
I think if you forget everything, don't forget the slide of the red flags, because 95% of the time low back pain is simple. 5% of the time it's something more sinister requiring effective and quick diagnosis and treatment. And wherever we are able to identify the appropriate cause, gives us the best case result and the best chance to get your lower back pain treated for the longest period of time. I think that's my take home.
That is a perfect way to wrap up today's session. Okay, so I think thank you so much, doctor. So even for me myself, I think I've learned a lot today, and I believe our audience here does too. So what we can see from today's session is actually low back pain is something preventable, in fact highly preventable, and also with proper diagnosis it is most likely treatable, and the ultimate outcome is to help our patient to get back to their life as near as possible after the proper treatment. Okay, so I think thank you everyone for joining us today. Okay, yeah, okay, thank you, doctor, for your time.
Thanks,
and
Bernard.
I wish that you will stay safe, okay, and stay healthy, and thanks again for today's session.
Don't spend too much of time in your seat.
Yeah,
Bye-bye.
okay, thank you. Okay, bye everybody.